Okay, let's dive right into this. Today, in this explainer, we are unpacking a highly complex, frankly shocking operational matrix that's been hiding right under the radar in California's county jails. We're looking at Wellpath, which is one of the nation's absolute largest for-profit correctional healthcare providers. By digging through an incredibly detailed array of institutional audits, federal court dockets, and financial intelligence, we are going to explore exactly how the structural architecture of privatized healthcare intersects with the harsh realities of the carceral system. We're really focusing in on the systemic failures and patterns here. We've got to anchor this explainer in a pretty stark reality. In Shasta County, a massive $12.75 million settlement was paid out after intake staff simply ignored obvious signs of a lethal methamphetamine overdose. And the really concerning part? This isn't just an isolated incident. Across Northern California, from Alameda all the way to Nevada County, multi-million-dollar payouts for wrongful deaths and systemic medical neglect have become an alarming, highly predictable pattern. So you really have to ask yourself, how does a healthcare system, something fundamentally designed to save lives, become a multi-million-dollar liability machine? Well, we are about to take a forensic journey into the intersection of corporate profit, localized risk management, and strict constitutional mandates. As you'll see, we're going to uncover how financial incentives directly and predictably dictate clinical outcomes. Here is our roadmap for today. We'll be covering 1. The cost of privatization, 2. The anatomy of understaffing, 3. Patterns of medical neglect, 4. Corporate liability shields, and 5. The crisis of local oversight. Let's start right in with Section 1, the cost of privatization. To really grasp the staggering scale of what we're dealing with, let's quickly trace the timeline. Back in 1983, a local physician-owned group called the California Forensic Medical Group, or CFMG, was founded. But fast forward to 2018, and a private equity firm, HIG Capital, swoops in and merges CFMG with another entity. This creates Wellpath, a massive private equity-backed monolith, but by 2024, weighed down by $644 million in debt and over 1,500 active lawsuits, Wellpath files for Chapter 11 bankruptcy. This wasn't just a minor corporate hiccup. It was the inevitable culmination of an incredibly high-risk operational model. And that model creates a profound structural friction. On one side, municipalities have a strict Eighth Amendment constitutional mandate, meaning they have a legal, inescapable duty to provide adequate medical care to incarcerated individuals, period. But on the other side, you have the corporate profit incentive. These vendors operate on fixed-fee contracts with very strict margin expectations. So what happens when the cost of providing constitutional care exceeds that fixed budget? Well, these two fundamental directives violently collide. Which leads us directly into Section 2, the anatomy of understaffing. Now, what's really interesting about this is that understaffing isn't necessarily an accident. It's often a highly calculated financial choice, known as the liquidated damages paradox. Basically, in places like Alameda County, the contract imposes financial penalties, liquidated damages, if Wellpath fails to meet minimum staffing ratios. And in 2024, Wellpath paid $2.1 million in these exact penalties. But here is the truly disturbing paradox. Because recruiting and retaining full-time registered nurses is prohibitively expensive in California, the intelligence data shows it is mathematically cheaper for the corporation to just operate with vacant positions and pay the multi-million-dollar penalty to the county, rather than actually fully staff the jail. It is literally cheaper to break the rules. Let that sink in. And you have to compound that chronic understaffing with some severe technological debt. Wellpath relies on a proprietary electronic health record system called IRMA. Independent audits by Forvis Mazars actually concluded that this system is 15 to 20 years behind modern community standards. 15 to 20 years. It lacks basic interoperability, so when a patient goes to an off-site hospital and comes back to the jail, their return documentation is frequently lost or just completely untracked. This deliberate operational choice actively worsens the staffing crisis, basically forcing already overworked nurses into a deadly communication silo. All right, moving on to Section 3, patterns of medical neglect. So to hold a corporate proxy accountable in federal court, plaintiffs have to clear a phenomenally high legal bar known as Penal liability. You can't just prove a nurse made a mistake. No way. You actually have to prove that a constitutional violation resulted from a widespread established corporate custom of deliberate indifference. You literally have to prove that these exact systemic failures and cost-cutting policies directly caused the harm. And our source material documents these exact customs happening across multiple counties. We see falsified intake forms designed explicitly to avoid the cost of hospital transports. We see the lethal ignoring of severe opioid and alcohol withdrawals. We see licensed vocational nurses, or LVNs, being forced to operate illegally outside their scope of practice just because there are no registered nurses on shift. And we see falsified welfare checks, where staff mark an inmate as okay without even glancing into the cell. These absolutely aren't one-off mistakes. The intelligence indicates they are highly predictable patterns stemming directly from the corporate model. And this brilliantly illustrates the devastating human cost of these patterns. Let's go back to the Randall Johnson case we mentioned at the very beginning. An inmate and the arresting officer explicitly state the inmate swallowed a massive quantity of meth in a suicide attempt. Yet, the intake nurse checks no for drug use on the chart. He was placed in a safety cell where he slowly died over 2 days without emergency transport. That falsification on the intake form, that is the chilling embodiment of systemic deliberate indifference. So, if the systemic failures are this widespread, how on earth does the corporation survive the massive legal fallout? That brings us to Section 4, Corporate Liability Shields. Wellpath utilizes a highly sophisticated $15 million tiered self-insurance structure. It's basically a financial fortress. Step 1 is a $3 million fronting policy. Step 2 is a $5 million self-insured retention, which means they pay that directly out of pocket. Step 3 is a $7 million policy provided by a captive insurance company. Now, what's a captive insurance company? It's a subsidiary existing solely to insure Wellpath. Because they are paying the first $15 million out of internal capital, they have a massive structural financial incentive to refuse settlements, drag out civil discovery, and litigate these cases to the absolute point of exhaustion. Plus, when someone dies, the facility generates a root cause mortality review. But corporate lawyers routinely invoke the PSQIA privilege. That's the Patient Safety and Quality Improvement Act. By claiming these reports are generated exclusively for a federal patient safety organization, they effectively shield the exact mechanisms of their clinical failures from civil discovery and even from county auditors. It essentially turns jail deaths into a legally protected block box. And when the litigation burden still gets too high, there is the ultimate shield, $550 million. That is the astounding amount of pre-petition debt completely wiped out by Wellpath's recent Chapter 11 bankruptcy. It's a maneuver known as the Texas two-step. By filing in Houston, it allowed them to secure an immediate stay, halting roughly 1,500 mass tort lawsuits nationwide, forcing victims into a diluted liquidating trust, and allowing the company to emerge cleansed of its legacy liabilities. It's a real game-changer for avoiding accountability. Which brings us to our final section, the crisis of local oversight. What we are really looking at here is a severe jurisdictional mismatch. At the federal level, the Department of Justice can launch CRIPA investigations, and federal judges can issue massive contempt fines, like a $2.47 million penalty we saw in Monterey County. But locally, it's a different story. County civil grand juries write these scathing reports exposing systemic neglect, but they entirely lack the statutory power to mandate contract changes. Boards of supervisors are trapped by a consolidated vendor oligopoly. There are only a few massive companies that do this work, and scaling up a public county-run health alternative overnight is virtually impossible. So the crucial point is, the trap of this oligopoly is undeniable. Take Shasta County. Reeling from that $12.75 million settlement, they terminate Wellpath and hire a new vendor, Medico, at a 40% premium, a $25 million contract. But Medico also carries a history of wrongful death lawsuits in other jurisdictions. The county just swaps out the logo on the uniform, but the root cause, the fundamental risk of underfunded, privatized correctional health care, remains entirely intact. So I want to leave you with a final provocative thought. When bankruptcy cleanses corporate liability and local oversight is trapped by a vendor oligopoly, who is truly paying the price for privatized healthcare? Taxpayers are footing the bill while the staggering human cost remains hidden in the shadows. Thanks for joining me for this explainer. Keep asking the hard questions and keep demanding accountability.